Hello everyone. The drug we are today going to discuss is Abrotanum. The common name of Abrotanum is Southernwood and it belongs to the composite family. Let's see what it's all about. First come to the constitution. See, marasmus of children with marked emaciation, especially of legs, in bracket iodum, sanicula, and tuberculinum. The skin is flabby and hang loose in folds of neck if it is, then natramure and sanicula. So the constitution of Abrotanum says we all know a disease named marasmus, which is a protein and energy malnutrition in children with marked emaciation. That is important. But where especially of the legs. That means if a patient who comes to you with a marked emaciation of the legs, as we all know in homeopathy, the name of the disease do not hold much importance than its symptoms. So we will focus on the symptoms more than the name of the disease. So the patient may suggest or may comes with marasmus or kwashiorkor or whatever the disease it is, or any undernutrition or malnutrition. But if we see the children having the legs are emaciated than the upper part of body, then we can think of few medicines, among them Abrotanum, Iodum, Sanicula and Tuberculinum are there. Now the skin is flabby and hang loose in folds of neck, natrum, and Sanicula. So one symptom is emaciation of leg, where Abrotanum, Iodum, Saniculum and Tuberculinum comes. And another symptom is skin is flabby, hang loose in folds. We all know as marasmus or any other protein energy malnutrition, there are proteins which are known as the building blocks in our body. Now when the skin loses it, basically it loses its laxity, its texture, and that is the reason they become wrinkled like old people, so hang loose in folds as if the person is very old. So if it is in neck, then we can think of natramure or sanicula. But otherwise, if it is in body, then we can think of abrotanum, also natramure and sanicula too. But the reason for natramure and sanicula for like this skin or flabby or the loose skin is not alike abrotanum. So abrotanum has a deficiency that is important. Abrotanum has deficiency, as you all know, there is protein energy deficiency or protein deficiency, resulting of which there is emaciation of leg, resulting of which there is skin flabby and hang loose in folds. Now why the patients having marasmus like symptoms or any protein malnutritions, or maybe there are some other causes because of which the patients having protein deficiencies or energy deficiencies. Let's focus on this. Come to the mental generals, that is the mentality. How would be the mentality of Abrotanum, based on which mental symptoms or the temperament we can assess the patient belongs to the Abrotanum group or not. See, child is ill-natured, irritable, cross, despondent, violent, inhuman, would like to do something cruel. So from all these things we can bring one word, that is cruel. That means the child is ill natured. Even though parents are trying to give their child the best education they can afford, with the school education, with the parent education, with the social education, but still the child did something which is termed as cruel. We all see puppies in roadside, but whenever we see the puppies, there are some slight cuteness we show as our gesture. But in case of Abrotanum child, they will be cruel. That means even they have been given the good educations, but still they will be cruel. They will throw stones to them. So it is not like someone taught them to do that. it is still something coming from inside. In homeopathy, we have the term we all know, that is miasm, or also we call the constitutional pollution. What does this mean? We know there are certain diseases which have names, right? But there are so many diseases that were previously in our generations and different generations of our, they are basically all hereditary. That means they all will carry from generations to generations to generations. That means even though I do not do any bad works or any other, we maintain some hygiene and all that things, I still have diseases. I might have some manifestations of symptoms which basically I acquired from the previous generation. Now, that is the constitutional pollution. That something that I inherited from my past generation is within me. So even if I get the proper education and all those things, still my mental and physical character might be different than what I am getting. I might be comfortable in certain odd things than the others. These are all the symptoms, these are all the manifestations that we get from our previous generation. So Aboriginal child are like this, children are like this. They are violent, they are inhuman. They know this is humanly wrong, but they still do this. So this is how Abrotanum children or Abrotanum persons can manifest. Remember, they are irritable, they are violent, they are inhuman, and they are cruel. Most probably, we will use the term cruel. Next, come to the physical general part. See, the ravenous hunger, losing flesh while eating well, one of the very important symptoms. See, the patient came to you and say, if my child, the mother of the patient says, even my child, I feed him quite good, but still patient lose some weight, still he do not gaining some weight. That means the patient might have some problems in his digestion or in assimilation. The patient's taking much foods, adequate amount of foods, but his body is not capable with it. So that is basically something, some problem inside of that person is going on, which cannot be assessed by any instruments in our body, sorry, instruments in our science. So that represents there are some pollution in his bodies which are carried away from generation after generation. Due to the lack of our scientific advancement, we are unable to understand this. But the manifestations is quite good. The patient is getting enough food but losing its flesh, losing its you know weight, and that is what Abrotanum. So see, Abrotanum patients getting enough food, but due to any other miasmatic background or reasons, the patient cannot assimilate, and that is the reason he is or she is losing the protein and energies, and because of which there is emaciations. And the peculiarity is that the emaciations is over the legs and the skin, they are flabby and hang loose in folds. Remember, the symptoms are same in iodum sanicula, tuberculinum, or in Natromura, but the manifestations are same, but the causes may be the different. Causes may be different. Okay, now Abrotanum hold this cause. So till now, if I have to gist Abrotanum with its peculiar picture, then I must know the patients are having good food, but he is unable or she is unable to enjoy it, unable to, you know, assimilate it, and resulting of which the patient is losing flesh, particularly over the legs area, and also the skin are broken down, they become flabby, they become loose. And similarly, the effects in the mind section of the patient. The patient is cruel, in a simple term. Okay, next come to the latter part, that is the particular part. That means in homeopathy we all know there are some symptoms which are basically which are basically particulars and which are generals. What is the meaning of this? Particulars are those symptoms which patients come to you and says, doctor, I have this or that. But the generals are that symptoms which you have to find out the essence of that particular. Now, in particular symptoms, the patient might say, see, in marasmus head, we cannot hold it up. You have to see the patients. When you see these patients, you might see the symptoms. It is not that kind of symptoms that patient will tells you. Face old, pale, wrinkled, that is the character of skin, is prominent over the face. And now come to the gastrointestinal system, alternate constipation and diarrhea, the term lienteria. Why this happens? Because the patient's problems regarding digestions or assimilation. Now, the patients are quite unable to digest the good food, and resulting of which sometimes the patient gives having loose stools, and sometimes the patients having hard stools, and that is the problems, and say alternate constipations and diarrhea. They are not the term that actual constipations, mostly the hard stool, and they are not the term the actual diarrhea, that is the definition of medicine. No, there is the loose stools. The lienteria means undigested food particles. Undigested food particles comes out like a small hard solid balls. That is, these are totally undigested. Now this is the symptoms. This comes from the Abrotanum itself. Now the fun part in homeopathy, the Abrotanum, the extremity part. See the painful contraction of the limbs from cramps or following colic. So it says the contractions of limbs from cramps or following colic. There is a huge pain in the limbs of the patient. It may be over the bone, over the muscles, or wherever. See the rheumatism for excessive pain before the swelling commences. We all know rheumatism means the pain over the joints, but if there is a pain, that means there are inflammation. It may be acute or chronic, but whenever if there is inflammation, there are signs of inflammations. We all studied in pathology that rubor, dolor, calor, and tumor, that means redness, pain, increased temperature, and the swelling. Abrotanum is applicable in these cases where the inflammation is not completed, the swelling not yet came out. That means before the swelling commences, before the stages of swelling, there means there might be inflammation, increased temperature, there may be pain and other things, but not the swelling. Now here comes the important part which holds the key of Abrotanum, that is from suddenly checked diarrhea or other secretions alternates with hemorrhoids or with dysentery. So this says Abrotanum is specifically applicable where when the pain in the joints appears from suddenly checked diarrhea. The patient was having diarrhea or patient was having any kind of secretions, but suddenly the secretion stops and the pain over the limbs or joints reappear. So this is what hold the key points of Abrotanum. That means there is the manifestations of our body. Obviously it is a peculiar manifestation, do not represent such disease symptom, but yes, it is a manifestation. If you find this kind of symptoms, think for abrotanum once at least. Alternate with hemorrhoids or dysentery, or with dysentery. If the patient having dysentery secretion, or the patient having hemorrhoids, that means bleeding hemorrhoids. The patient was having bleeding piles, but the bleeding stages and then the pain starts over the joints. So then you think of abrotanum, obviously considering the main constitution of the abrotanum, that is defective assimilations and digestion, resulting of which emaciations peculiarly over the legs area and the person become cruel. Next, see, in the extremity, the term gout, it is a clinical term. As Allen's keynote is a clinical materia medica, you will often find some clinical terms in here. Joint steeps, swollen with pricking sensations, wrist and ankle joints painful and inflamed. Abrotanum has specific actions over the small joints like wrist or ankle joints. But remember, this is the basically the symptoms of gout. This is the actual medical symptoms. There is nothing peculiar of it. Very lame and sore all over the body, painfully hard, that is lame and sore. Marasmus of lower extremities only, as I've already discussed. The emaciation over the legs only. Now, in case of fever, we can think of abrotanum, but the symptoms must correspond: great weakness and prostration, and a kind of hectic fever with children unable to stand. That means hectic means when the patients, that means the fever, do not comes in a specific temperature. That means when it goes up, sometimes down, sometimes in between, up, down, up, or anything. The temperature fluctuates. It do not stays in a specific portion. That is the abrotanum fever. So if this kind of fever with the symptoms corresponding, the emaciation, defective assimilation, the cruelty in the patient's mind, the patient is having very gesture where the stooping shoulder or head down, difficulty in raising the head, weakness, or the symptom changes, in that cases we can think of abrotanum. And lastly, see, it is basically a symptoms where itching chilblains. It is a simple single line, nothing such has been given here. Now last part of abrotanum is relation. What is relation? After hyper in furuncle, furuncle is a term, surgical term. It means boils. Boils means, we have a skin, there is a hair follicle, and in their hair follicle, when you shave, particularly after shaving, you just cut it down. That means it is a simple like this. So often the shaving part of the boils of the hair follicles get trapped inside the skin, and resulting of which it is create a bump, and followed by it will create such things inside the hair follicles. The hair follicles facing difficulty in moving upwards, and that is called boil. Now boils are furuncles and staphylococcal infections, we all know that. So in painful boils or in painful furuncles, we often think of high sensitive furuncles, we often think of hypersulfur. But you have given hypersulfur, but there is something that is producing hindrance in the cure, then you think of abrotanum. After aconite and Brownian pleurisy, when a pressing sensation remains in affected part, impending respiration. So the patient was having pleurisy, but there's some part you have given the Brownia or aconite, but the patient is not totally recovered. Something, some sensations preventing his respiration, proper respiration. In that case, abrotanum works good. Now the relation part we all know in Allen, it is a totally experience based symptom where Dr. H.C. Allen or Dr. Constantine Herin previously given this, but after the symptoms he used abrotanum based on certain symptoms, and he get the proper cure. And that is why he has written down this. These do not holds the actual constitution or generalities. These are the symptoms of experience. So thank you. This was all about abrotanum. We will study abrotanum from another book in another day. Thanks a lot.